Happening today, Columbus Public Health is hosting a monkeypox vaccine clinic. It is from 9 a.m. until 4 at their location on Parsons Avenue. You have to register for an appointment. We do have a link at 10tv.com/feature links. Now, doctors are always taught to follow the science, and the latest data shows monkeypox is right now disproportionately affecting those who identify as LGBTQ+. That's why as vaccines rolled out, so did the marketing plans. The goal, reaching those at risk without damaging public perception. It's a challenge, especially when the audience is a community that has been there before. Here's medical correspondent Tracy Townsend.
How do we reach these medically underserved communities?
Doctors from healthcare provider Equitas Health joined 150 organizations around the country in August, demanding a more culturally humble and urgent response from the government to monkeypox.
Yes, mortality rate is low, but we still have an unprecedented number of cases.
Dr. Rhea Debussy leads public policy efforts for Equitas, an organization that is focused on supporting the LGBTQ+ community.
The way public health issues emerge, that is not something that is uncommon for one population to be disproportionately affected and for it to sort of then become an issue for a much larger population.
This virus opens a painful wound for the LGBTQ+ community, the HIV epidemic in the 1980s, when a mysterious virus was claiming lives and dignity.
Along with the death sentence, stigma defined what it meant to have HIV or AIDS.
Dr. Ronald Bayer's research at Columbia University focuses on social justice related to AIDS. He studies why, for 15 years, no effective treatments were available. With monkeypox, a vaccine is available, but the challenge is this: reaching those at risk without implying the virus is a gay disease, somehow making the community seem unclean or vulnerable for being who they are.
Yeah, there's a huge component, right, of sharing and making sure you're being intentional with your marketing efforts and making sure that you're communicating that something like monkeypox is not something that can only affect men who have sex with men or trans, non-binary, and gender expansive folks. But communicating that based on the data we have now, that is who is being disproportionately affected at this time.
I mostly try to give people good information.
Dr. Shane Jeffers is with Mount Carmel Medical Group.
I had an 80-year-old woman asking me about getting that vaccine here recently. People don't know how it's spread. It's mostly through very close physical contact, mostly from sexual. It takes a lot of friction to really spread monkeypox. So you're not going to pick it up on the cart at the grocery store like a lot of people think. Make an appointment and get it done. I'm getting mine done today, actually.
And that was Tracy Townsend reporting. Dr. Anthony Fauci, by the way, often says stigma is the enemy of public health. We will post information on 10tv.com about resources Equitas offers.